So it's been a couple years since that survey, and we're actually gearing up to do another one.
One of the things you've been working on really is understanding API and API standards across the EHR systems in healthcare. I know it's a project I think you've been working on for a while, if I understand it correctly. Can you tell us a little bit about that?
Sure. Yeah. API stands for Application Programming Interface, but that's technical language for how does one computer or a computer program talk to another one, and in essence speak the same language so they can pass information back and forth. So one of the things that that has happened in the last 15, 20 years as like consumer technology became more prevalent, people are very used to, let's say, opening up an app on their phone and ordering something from, a food delivery service. Just very easy to transfer. Here's some information I want to send, and then I get a service delivered back. So in the consumer world, digital technology is frictionless. But in healthcare, there's been a lot of friction, and in part, how can information be shared between, let's say, a patient or, let's say, a digital health vendor, a company that offers digital health solutions, and the electronic health record, which is sort of the work environment and almost like the source of truth for everything that goes on in the healthcare setting. So if you're, for example, a company that's developed some tool that helps patients monitor their glucose or their step count or anything relating to health, and you want that data to flow either into or from the electronic health record, you have to use these APIs to get the data to flow. A lot of people don't think about this, but this is like all the pipes that are inside the walls of a building. You don't usually think about it. You just go to the faucet and you turn it on and water flows. But connecting all the pipes takes a lot of work. And it's not always easy to do. And so we actually did a survey of digital health companies in late 2022, but we published it last year, about their experiences with using what are called standards-based APIs to connect or integrate with these commercial electronic health records. And the reason we were interested is that the federal government, at the time it was called the ONC, the Office of the National Coordinator, had put out policies about commercial electronic health vendors should make standards-based APIs available. They were mandated to, so that it was easier for these companies to integrate into the electronic health record. But nobody had any idea, did these standards work? What were the companies' experiences when these things were supposedly turned on? So we did a national survey to try to understand it. And we found that a lot of companies, while they were using standards-based APIs, the ones that sort of we want to make so that it's easier to integrate, a lot of them were still using these proprietary APIs because for some reason or other, they had to do both. And when they were using APIs, there were still lots of barriers, like high cost, difficulty finding what are called API endpoints, like where do we send or extract the data from, and things of those sorts. So it's been a couple years since that survey, and we're actually gearing up to do another one that we will be launching this winter to see, has the needle moved on federal policy and trying to make it easier for these companies to integrate into the electronic health record.
Well, you probably saw a couple of weeks ago the big push from CMS, right, with the different networks pledging to support. And a big part of that initiative is actually to make healthcare data available. I'm particularly excited myself to see individual access services, or an ability for individuals, right, like myself, to authorize another application to access my health record and actually be able to find that. Because I think for far too long, people have been trying to get their medical records all in one place, just as individuals, like particularly if I have a complex or rare disease. And we see, people walking around with banker's boxes full of paper records still, and printouts from different things. And that's just not how we should do things in a modern digital age. But I don't think we've had the technology, or even if we had the technology, we didn't have the governance systems really to establish who had to share what with whom and why and where and in what standard form. And so even if we all agreed it was a good idea, we didn't have an agreed method for this exchange. So I'm pretty excited. What was the results of the first survey? You said it was that people were still kind of running standards, but then they had their own proprietary APIs. Was there a sense that things were moving towards more standardization, or was it still a very fractured field?
Yeah, it was pretty fractured. And the timing of that first survey just happened to be um, just months after the mandate from something called the 21st Century Cures Act went into effect. So we probably would not have seen a whole lot of effect yet because the deadline for these commercial electronic health record vendors to implement these things was right upon us as that survey went out. So in a way, that survey sort of set a baseline. And the survey we're about to launch this winter will actually show us, has the needle moved at all since the 21st Century Cures Act mandates went into effect? And then where might we need to focus future policy attention to help continue to take the friction out of the system?
Yeah, totally agree. So tell us about, you're running the new survey now. If someone felt like it was something they wanted to participate in or they were interested in, how would they get involved? Is this something that other groups and companies can get involved in?
Yeah, we actually have a pre-registration website. These are for intended for digital health companies that integrate into electronic health record. We plan to probably disseminate that survey in the winter of 2025-26.